introduced the high-tech GeneXpert diagnostic tool. Well, it provides high-quality results. But then how big a difference will this make in curbing the TB and HIV co-infections that pose particular diagnostic challenges? Now, to discuss this, we are joined, of course, in the show from our Cape Town studio by Professor Keertan Dheda, head of the Division of Pulmonology at the University of Cape Town. Professor, welcome to AM News.
Thank you.
Why is TB still a major problem and concern in our country at this day and age?
TB remains a huge problem in South Africa. It's now officially the commonest cause of death, and for a population of approximately only 50 million people, we treat over 500,000 cases of TB per year. And these are just the cases we diagnose and treat. There's an equivalent number of undiagnosed cases in the community. So approximately 2% of the population has TB. And this has a huge impact, not only in terms of morbidity and death rates, but also in terms of impact on the economy. And it's estimated that TB reduces our GDP by approximately 5% to almost 14 billion rand. Now, if that were not enough, as you know, TB is also the commonest opportunistic infection in HIV-infected people. But what has also now taken center stage is the problem of drug-resistant TB, which I'm sure many of your listeners will be familiar with. It's been on the news many times. And that's now been superseded by a very resistant form of TB called super drug-resistant TB in the lay press, but also called XDR TB. And we now have incurable cases of TB which don't respond to treatment at all. So TB remains a huge problem in the country.
Now, Professor Keertan, when should people be worried that they might have TB? And if that's the case, what should they do about it?
The symptoms to be concerned about are persistent cough. So we're not talking about cough for a few days. Many of us have a head cold or a bit of a flu and you cough a little bit. But we're talking about a persistent cough over several weeks, persistent fevers, persistent what we refer to as drenching night sweats, where the bedclothes are wet at night. Again, when this persistently occurs, unexplained persistent fatigue and weakness, and coughing up of blood sometimes. And these are all symptoms which should make one think of tuberculosis. And if you have such symptoms, you should either go to your GP or go to your nearest clinic to get an X-ray and a sputum test for TB.
Professor, is TB a problem to diagnose?
Yes, so TB remains a huge problem in terms of diagnostics, and there are several reasons for this. Unlike in HIV, where one has a simple blood test that one can do, in the case of TB, there is no simple blood test that one can do to prove the diagnosis of active TB. And so one needs to get a sample from the site of disease, and that's where all the problems begin, because particularly in South Africa, where there's a very high proportion of HIV-infected individuals with TB, up to 40% of these individuals find it very difficult to bring up any sputum or have very low-quality sputum samples where the density or concentration of bugs in the sputum is very low. So that's another problem. There are also different types of TB. Most of the TB we see is called pulmonary TB and constitutes usually about 80% of tuberculosis. But in South Africa, having a high prevalence of HIV, up to 40% of people have extrapulmonary TB, where the TB spreads outside of the lungs into other parts of the body. And when one has TB affecting these different organs and parts of the body, diagnosis is very difficult, because the concentration of bugs in the fluids or in the tissues affecting other organs is very low. There are also problems with diagnosis of TB in children, where it's very difficult to get a sputum sample. And the additional challenge with TB is that there's also a form of TB called sleeping TB. Now, just to keep this very simple, there are two types of TB, sleeping TB and active TB. And in the sleeping form of TB, we do not treat that in South Africa. That's TB where the X-ray is usually normal. It doesn't cause any problems, and it just lies dormant in the body. Now, what that does is stimulates the immune system. And so really, if we use antibodies or the body's immune markers to diagnose TB, that can be quite unreliable. So many reasons why diagnosing TB is not straightforward.
All right, Professor, let's talk about spine TB. I mean, how severe is it and how is it diagnosed?
Sorry, just repeat that question.
Spine TB rather. Let's talk about spine TB. How is it diagnosed and how severe is it?
Right, you're talking about TB of the spine and the spinal cord.
Yes.
Yeah. So spinal TB forms a very small proportion of TB cases. It's a form of extrapulmonary TB. Remember, I spoke just now about TB occurring outside the lungs, but it remains a major problem and a cause of paralysis, particularly in the lower limbs in South Africa. And one should be concerned about this form of TB if one has persistent back pain, particularly pain in the center of the back rather than the lower back, together with some of the symptoms that I mentioned.
All right. Tell us more about the new GeneXpert test for TB and also the urine LAM test.
Well, the urine LAM test is really the first point-of-care test for TB or low-cost point-of-care test. And by point-of-care test, we mean one is able to do it at the bedside in the clinic. And a minimally trained healthcare worker can do the test. So this is a simple urine test. You put a few drops of urine on a little strip, similar in some way to a pregnancy test, where you put a few drops of urine on, and it tells you whether there's TB or not. However, this test is only useful in HIV-infected people, particularly those with low CD4 counts. And there's currently lots of research ongoing about how best to use this, and we're conducting some very large studies in several African countries, including South Africa, in hospitalized patients, particularly those who cannot produce sputum and in whom other types of diagnostics may not work that well. The other test you referred to is the GeneXpert test. This is a test where there's amplification of the genetic code of MTB, and that's how the diagnosis is made. It not only does it tell you whether you have TB, but it also tells you whether you have drug-resistant TB. And we referred to this type of technology as PCR, a PCR-based test. And this technology now has been rolled out throughout South Africa. So anybody walking into a TB clinic anywhere in the country or in a hospital should have access to this test. And the major advantage of this test, firstly, is that the sensitivity or accuracy of the test is much higher than the previous test we used, which was smear microscopy, where we just looked at the bug under the microscope. So previously, we could only diagnose about 50% of cases of pulmonary TB, and this test increases that accuracy to 80 to 85%. Wow. So it is a real advance in TB diagnosis. It enables a much more rapid diagnosis to be made, and so with people being diagnosed more rapidly, they're less likely to drop out of treatment, and also less likely to transmit disease in the community.
All right. Thank you very much, Professor Dheda. Thank you for joining us.